Hello, my name is Casey McDonough, and I am currently working at a large Trauma One hospital. I'm in the operating room, and I'm a nurse, perioperative nurse, they call it. So I work with the patients while they're asleep and while they're getting an operation. I also help the surgeons and the technicians and anyone else to get the materials they need, open them, and make sure the equipment's working right. Um, I have two kids, two teenagers, and they're pretty good kids. I can say that because I raised them by myself while working and going to school. One of my short-term goals, obviously, is to finish my bachelor's program to keep my current job. It's a requirement of my position now. And one of my long-term goals after finishing my Bachelor of Nursing is to go into a family nurse practitioner program because my favorite practice experience was actually in a family practice office, and we basically functioned as nurse practitioners. We did everything except for, well, we even electronically signed prescriptions, but we did everything except for the final assessment and the stamp of approval saying, okay, I agree with that. So, assessment and minor surgeries and everything. And I really think the patients like talking to us nurses almost better than the doctors sometimes because we listened and we tried to figure out what was going on to help them, what would work with their lifestyle. So, I actually had really good training for that, and I'd like to continue that and to be able to do it legally without a doctor there who has to put the stamp of approval on it. Um, One really positive experience I had with nursing leadership was when I first started in the Raleigh area. I moved into a group and I knew nothing about the organization, and I was just placed into a cluster. And the leader, I thought she had military background, just the way she spoke and the way she carried herself, and I was like, oh my gosh, she's going to be given all kinds of demands and commands. But um, the way she spoke was very succinct. I guess she was very short and to the point, which I really like. Um, she also was very clear with her message about what needed to be done and what was expected. She set the expectations of perfection and top quality and patient first. But at the same time, if you had a question, you could ask her anything. And if she didn't know the answer, she'd find out for you. So I really enjoyed working with her because there wasn't a slacker on the team. If they didn't want to live up to those high standards, they went somewhere else. And we all functioned, those of us who stayed on the team, we all functioned just very well. We knew each other would do 100% and take ownership of every task that they were assigned. One real negative experience is actually as a current experience that I moved to a different shift, which has a different supervisor, and the supervisor is very relaxed about everything. She doesn't have high expectations of the team members. If we don't get to it, oh well. Just as long as we get the cases done, there is no trying to make decisions to make things better. There's no trying to improve processes or improve practice at all. It's just, okay, here's how it is. This is how we're going to do it. And if you ask her any question or try to give any feedback, it's almost like it's a scripted answer directly from some company manual somewhere. So I'm really glad I had the positive experience with the first supervisor to know that not everyone in the organization is kind of brainwashed and has a policy manual that they read their answers from. And it's very frustrating too now to have the supervisor that just, it's almost like she doesn't want to listen to anything. She just wants to give out orders. And just real quick is I'm training for that supervisor role that she currently holds, and I'm actually, well, I'm done training. There's just no positions open, but I'm trained to do that position. It's even more frustrating because I'm not a manager or a supervisor per se, but the whole team looks up to me for answers. They don't even go to her anymore. They come to me and ask for all kinds of details and all kinds of information that she should know but doesn't know. So I'm kind of at a loss sometimes where I have no one to ask because I don't know, and it's an evening shift, so there's not a lot of people who've been there for 30 or 40 years who know the answers. A lot of times I have to figure out the answers, or we just have to go with what we can. So in this class, I'm hoping to learn how to be not like her and a little less authoritarian. I kind of fall in the democratic range of leadership, so I hope to really strengthen my areas of weakness. Thank you.